Hi, my name is Mary Albus. I'm a registered dietitian at Gainful. I live in New York City. I graduated with a bachelor's in nutritional sciences from Penn State University. And I've been a practicing dietitian both in clinical and community settings since becoming an RD in 2018. I work with Gainful subscribers to achieve their health, fitness, and nutrition goals.
I'm Dr. Jaclyn Tolentino, and I'm a senior doctor at Parsley Health. I currently live in Los Angeles, California. I'm board certified in family medicine, but I practice integrative and functional medicine at Parsley Health. At Parsley, our job is really to work with our patients to focus on what is an attainable goal. How can we really set something that's attainable for you? And then really focus on what that sustainable path is going to be to achieve that little by little. Otherwise, if we just really take a look at that whole picture and we say, okay, I want to go from 0 to 60 in 2 seconds, we're not going to be able to achieve that. And it can get too overwhelming and frustrating, and people lose motivation.
A lot of the times when we talk about people's expectations with these goals, I want to know the reasoning behind the goal and how you're going to make it enjoyable and sustainable for yourself. And so we want to be consistent and patient to see results. This is also why with like motivation and mindset, I like to set a number of goals outside of weight along the way to create this more well-rounded view of health, because we don't want to become discouraged when weight progress does hit that plateau at times.
100%. I mean, we see that quite frequently with the work that I do. And honestly, I think that really reflecting on it and having this perspective shift is really the most valuable process involving the meaningful changes that this person could make. More than any diet, more than any new movement or exercise plan, really learning to think about your health in a different way is something that you can have for the rest of your life. And it's just another tool that you can use to support longevity and optimal wellness, to have this mindset shift where you do some sort of reflection and then you have this perspective change.
We know changes take place over time. So I'm wondering, what's your take when it comes to habit formation and then tracking of those habits?
I know that some people don't find data helpful, but a lot of people do. And for the people that do find it helpful, it can be nice to have something that is tangible that you can use to help track and support whatever goal it is that you're trying to accomplish. But for people where data isn't really their thing, sometimes they can find it a bit overwhelming, and it can adversely impact their motivation to maintain their health or their wellness plan. So I think for people that are driven by data, it's really helpful to use fitness trackers or wearables or apps to help monitor your progress, because it's helping to support staying motivated.
I really encourage my clients to look at their journey from this broader lens where we consider so much more than just that scale weight. And one factor I encourage looking at regularly is things like blood work and stuff that can give you a much bigger perspective on how things like your metabolism and overall health have improved, where maybe your scale weight hasn't really reflected that progress. Day-to-day weight changes, such as like hydration status, sodium intake, carb intake, bowel regularity, stress, sleep quality, activity level, all this stuff can influence your day-to-day weight changes. So if you put all of your eggs into that one basket of just thinking about scale weight, it will lead to disappointment and frustration. So all of these other factors are going to keep you happy while you're reaching those long-term goals.
Ultimately, all of us as healthcare providers, our goal is just to make sure that this person is thriving and helping to support reaching their individual goals. And it's never just a doctor or just a health coach or just a registered dietitian or just the physical therapist. It's usually the village that really helps to support that kind of healing and step up.